Thank you, everyone, for joining us for another Learning Lunch hosted by Format Approved. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved. I'm joined today by Format Approved CIO Wendy Whitmore. Thank you for joining us today, Wendy.
Thanks, Brian. Good morning.
Today's Learning Lunch title is the HIPAA One-Day Training Challenge. So we're going to talk about what you can do and what the advantages are of mounting a one-day challenge. You can look at our bios while I go over some housekeeping notes. You can see we both have a lot of experience in HIPAA and online education that I think will serve you well in this webinar. Remember that you can ask questions of us at any time during today's session by entering them into the chat area. We should have plenty of time in the second half of our presentation for questions. So whether you have questions about training or HIPAA in general, we'd be happy to answer any of those for you. If we do happen to run out of time, we'll answer your submitted questions via writing in a follow-up email that we'll send out after this event. Remember as well that all registered attendees of today's session will receive an email that has links to both the slides from this event and a recorded version. We send those out whether you're able to attend the live session or not, so people always ask if they can get the slides, and rest assured we'll be happy to share those with you. All right, so let's address our first question. And the question is, why is HIPAA training so important in the first place? Wendy, would you care to weigh in on that to begin?
Sure. You know, it's fascinating to me working in the educational arena in healthcare that when I bring up the topic of HIPAA to our managed service provider partners, to our medical audience, medical provider audience, I am often surprised to learn that many people don't realize that HIPAA training is required on an annual basis. This is not something that we made up as educators. This is not something that was imposed for for arduous requirement reasons. It really is a specific and defined HIPAA requirement. And Brian, you can probably speak to this specific issue. It is now not only required of the covered entities themselves, the folks who are touching protected health information within that healthcare environment, it is also required on an annual basis for business associates, the people that actually work with any of those medical providers or have access to protected health information through their relationship with those providers. And I think Brian can expand on that a little bit. One of the reasons for this, and it's kind of an important reason, is that if you don't do proper training on an annual basis, there's turnover in businesses, there are changes to the regulations in some cases, and if you don't get that correct training, it really does increase the chance that somebody might breach data in your environment, and you really, really don't want that. Obviously, there are fines involved potentially, although many practitioners feel like that isn't going to affect them. But there are fines that have been imposed. If you keep an eye on the news, you'll recognize that there have been a lot of breach reports lately. There's been quite a lot of damage to individual medical sites' reputation. These are from my perspective as an educator, these are the most important reasons that you want to do that annual HIPAA training, besides the fact that it's actually a required part of the HIPAA regulation.
Yeah, I'd just like to expand on that. It's in the security rule that anyone who has access to protected health information has to get training on an annual basis. And as hopefully our audience knows now, with the Omnibus Final Rule, that's the regulations that enact the High-Tech Act, all those business associates out there who have access to PHI also have to complete that annual training. So it's a regulatory requirement, but to speak to what Wendy was just discussing, it's also vital for preventing breaches. So, you can see in the third bullet on your screen there that, yes, healthcare organizations and business associates have gotten into trouble with the Office for Civil Rights and HHS, that's the group that enforces it, but they've gotten in trouble for not doing their training. So people have certainly been fined for that. But the way that most people find themselves in a difficult situation isn't because they get audited, it's because they have a breach. And, if you follow the news, there's just a steady drumbeat of breaches happening, whether it's on credit card security or in HIPAA and healthcare. Both sides are seeing more and more attacks from hackers and just a constant barrage of breaches, it seems. And if you look at the actual circumstances of those breaches, most of the time what happens is that people haven't followed the right policies and procedures. They don't really understand what HIPAA requires, and so they've done things that have left them vulnerable to a breach. And so proper training and proper enactment of policies and procedures is absolutely essential to preventing that, and that's the thing that will keep your organization safe, is understanding the rules and making sure that all employees understand the rules. So our next question is, why is it worthwhile to create a one-day challenge? And, again, I'd like to hand this off to you to start, Wendy, because I think you've dealt so much with providers and with medical professionals. You can address this well, I think.
Yeah, absolutely. When we were talking to medical providers about their challenges, their internal challenges around getting their staff trained. And I've talked to everyone from hospital-level CIOs to medical practices with 4 or 5 employees. Curiously, both of those contributors to our conversation had very similar complaints, and their complaints largely were wrapped around trying to keep up with the annual training for their employees, whether they have a handful or hundreds, because understanding that it is the job of, let's say, the compliance officer or the manager at the practice manager to make sure that the staff gets that training on an annual basis. It's a little bit like, and Brian, I thought, described it well in his description of this registration for the webinar, said it's a little bit like herding cats. If you've got a lot of people and they all start and stop their training at different times of the year, or they have, claim that they've had training when they join your practice, but it seems like they don't really fully understand about the protection of health information, those kinds of things can create, I think, an awfully challenging training and tracking job for the compliance officer or manager. So as we were talking about ways to resolve that issue, one thing that popped up was the idea that you would consolidate that training for everyone every year, all in one day. And, or rather, better yet, we've actually got a solution coming out relatively soon that would allow you to get everybody trained basically in 1 hour. And how lovely is that, to get, essentially everything taken care of all in one fell swoop. Obviously, you have employees starting and stopping at different times of the year. There are ways in which you need to manage that. However, for the bulk of your employees, if you can get this done all at once, it really does kind of dial down on the various issues related to getting this requirement taken care of every year. So again, the training is required, so that's one important reason. If you don't kind of hammer it out all in one fell swoop, then you're going to deal with individual procrastination issues and staff buy-in and, engagement in the overall process. And as Brian mentioned, there are obviously other risks around breaches and audits and things like that as well.
Yeah, as Wendy was saying, it's just one of these things where, because, I don't know anyone who got into healthcare because they love HIPAA and, they're so passionate about it that they just decided to become a nurse on the side. That's me, but of course I'm not a provider. But I'm kidding a little bit. But I do appreciate the importance of HIPAA, and I'm sure that a lot of folks out there do too. It's just not at the top of anyone's list. So it's easy to put it off. And that's why, if you have this one-day challenge, you can herd those cats, as Wendy was saying, and you can get everybody to take care of it. And so then it sort of short-circuits that procrastination, because, for myself, I know that when I'm facing something that I know I need to do, but it's not, the most pleasant thing in the world, it's easy to put that off. And so this is a way to make sure that people actually do what everyone understands they need to do, but may not be eager to do. So that's a good way to get people on the same page in terms of completing their training. So let's talk about the steps that are involved in doing a one-day training campaign. There's 8 of these, and we're going to go over all of them because I think there's different aspects to consider about this. So obviously, in any project, you need to plan ahead. We'll give you some notes on that. You need to select a leader, and selecting a leader is important for HIPAA in general. So one of the things that we talk a lot about is the fact that the security rule also requires every organization to name a compliance officer. That's someone who's in charge of enforcing the security rule in that organization and making sure that that person or that organization meets all of the HIPAA requirements. Well, that has an important training aspect as well that we're going to cover. You need to select a date carefully. You want to make sure that you pick a date that isn't going to interfere with other operations. You want to promote the event with some thought in terms of getting people's attention and making sure that everyone's aware of it. Sweetening the deal can be a great way of getting higher levels of participation by coupling it with a pleasant experience or some kind of reward. It doesn't have to be anything elaborate, but people respond to even small rewards. You know, it doesn't take much for people to kind of get into an activity. And then it is certainly, and this is something we're going to talk about throughout our discussion today, is it certainly helps if people can get together and do it in the same room, but also if there's an option for people to be able to participate online. And so the model that a lot of people may be most familiar with when it comes to HIPAA training is for somebody to come into the room, an actual live human being, or at least a very convincing cyborg, to come in there and actually present in person on the content that you're going to cover. And there's a lot of reasons why that's not really the way to go these days, and so we're going to talk more about that as well. Maybe an easy sell to you folks, since you're already on a webinar. You may already appreciate the advantages of doing things online, but we'll talk a little bit about that. As we've suggested, creating competition in terms of how, who can get the highest score or complete their training first can be a nice way of incentivizing people. And finally, this is always important in these sorts of activities, celebrate success. If you meet your goals, make sure that people are rewarded, or certainly that you make the most of the fact that you've completed this training. Because again, it's not something that people get excited about, and so anything you can do to incentivize people to participate will help you succeed. All right, so why don't I hand this off to you, Wendy? Tell us about planning ahead for this event.
Okay, so again, this is, when you say you're going to mount a one-day or even a one-hour challenge, what you want to do is make sure that that the person responsible for compliance in your environment, if that is your compliance officer, manager, if that is your practice manager, if that is the practice owner, whoever that happens to be on that site, you want to make sure as that person, or that you've requested that person, plan ahead a little bit and for the highest level of participation. So first of all, that person should decide what kind of training to present. Do we want to provide training via an outside instructor? Do we want to provide training via an online delivery system? Do we want the compliance officer to do kind of an overview and then have the participants actually do a certificate process via some kind of computerized delivery system? Obviously there are a number of options, but regardless, however you choose to do your training, you want to make sure that you've got that kind of lined up, as it were. Make sure that whatever training model you choose is verifiable for audit and investigation purposes. So just saying that everybody in your practice trained, that is not sufficient. So even if you stood up there for an hour and you said everything you know about HIPAA and you're pretty sure you covered everything and everybody nodded their head a lot and agreed, if somebody comes in to audit your site and they ask you if you've completed HIPAA training and you say, oh yeah, we did that a couple months ago. I stood in front of the group in the conference room and told them everything they need to know. Unless there's some kind of confirmation of that is verifiable, that is not going to work for audit purposes. So you want to make sure you've got some kind of certification or certificate involved, some kind of signature page by the employees that indicate that they understand. I would go so far as to say, certainly in our programs, we are very clear on making sure that there's a percentage score requirement on a test at the end of the event, making sure that they actually do understand the information that was delivered. Because I don't know about you guys, but when I sit in on a conference of some sort, sometimes I'm paying attention and sometimes not so much. And if you tested me on every single meeting I sat in, I can promise you I probably wouldn't score 80%. But in the case of HIPAA, certainly for audit purposes, you need to make sure that you're able to demonstrate that those employees know what the heck they're talking about. You also want to make sure that whatever training model you choose can be accomplished in that day for all levels of employees. It really should be 2 hours or less. You don't want it to go on, drag on and on and on, because of course the more information you pump into these poor people, the less they're going to retain in that short period of time. And if you can, choose a model or method of training that can be reviewed or overseen by you, the compliance officer, or by your compliance manager at your site, meaning you want to make sure that that person can actually oversee the progress and completion and success rates of the people that are attending that training.
That's a vital point, because there's a lot of HIPAA training that is online now, and we certainly endorse that approach, but a lot of it is kind of you get access to a webinar, or maybe you just, are watching a slideshow essentially, and then the employee can print out certificates, but it can be such a hassle for the manager or the compliance officer to make sure that everybody has actually completed it. And it's really the health of the organization at stake here. You want to make sure that you've done what you are supposed to do to comply. And so tracking all of that down can be very difficult, but it really doesn't need to be in this day and age, because online tools should also enable you to go in as the compliance officer and oversee what the status is of your employees. So it's just unnecessary. I've heard from people who are trying to track all of this by spreadsheet. That's actually very common, and kudos to those people who are using their organizational skills that way, but it's not necessary these days to do it that way. You should have online tools that let you look at a glance to see whether people have completed the training. So selecting a leader is an important step, and I'll take this one first. Again, the security rule requires that you have a compliance officer, and that's true whether you're a traditional covered entity, meaning an ambulatory space or a hospital or what have you on the provider side, but also for business associates. So whatever your HIPAA status is, you have to have someone who is essentially the head of your security from a HIPAA perspective. And there's two aspects to that, I would say. One is there's a regulatory component. That person is the first person they're going to talk to if OCR ever comes to your organization. They're going to say, who is your compliance officer? And if you say, we don't have one, you've already failed. You've got to have one. So that's the person who's really your point person on all matters that are related to HIPAA. But there's also a champion aspect of it. And we often in healthcare speak of, the champion, the EHR champion, various roles like that. And here in HIPAA, it's also important to have a champion. So the compliance officer is the person who really is going to be the cheerleader for HIPAA, giving people gentle reminders about the importance of HIPAA, making sure that the organization does what it needs to do. Obviously, you want to have someone in that role who understands HIPAA. That person needs a greater level of training than most folks. Earlier, Wendy was saying, that this training should last less than 2 hours for members of the workforce. And the reason why is, as she said, people just sort of tune out after too long in a room listening to the same thing. But the other reason is that they don't need any more than that. Most people in most roles don't need more than about an hour or two of training to really understand HIPAA. But the compliance officer is someone who should take more time to have a greater level of understanding of HIPAA, because they're the person who really needs to understand, what does the security rule actually say? Is my organization doing everything that it needs to do? So to circle back around to training, the compliance officer is the natural point person to lead the training effort. This is the person who is likely to identify the company or organization that you're going to use to train. This is someone who's going to do all of the planning around it. And this is the person who, again, will serve that champion role as training approaches to say, look, we're actually going to make this fun. I know that people may have had, less than exciting experiences with HIPAA in the past, but this is going to be relatively painless, and it's really important for our organization. So all of those aspects are important in terms of selecting a leader for the process. Would you like to add anything to that, Wendy?
And I'll just jump in. Yeah, I'll just jump in with a couple of comments. Although obviously your compliance officer could potentially be a helpful person to coordinate this effort, there is an aspect of this that is about engagement and sort of, as Brian mentioned, the champion role and sort of firing up the group. If your identified compliance officer is not that person, put them together with somebody who really is likely to get buy-in from the team. A cheerleader, if you will, somebody who's going to, fire up the group. So as we get further into, our steps around what we recommend for this one-day challenge, you want somebody who's going to get folks excited about, whatever path you decide to take to make this event fun. You want to make sure it's somebody that, often gets buy-in on other kinds of events at your site. And so if that's not the compliance officer, you certainly want them involved in this process, but you may also want to have that compliance officer recruit a sidekick who can actually help fire up the team.
That's a great point, Wendy. All right, so selecting a date is obviously an important consideration. Why don't you handle this one, Wendy?
Sure. This is kind of seems like a no-brainer, I suppose. But curiously, what I find when I'm talking to compliance officers about their training efforts, a lot of them will tell me, honestly, things like, well, we only got about 50% participation because we did it on a Saturday, or we only, we selected, a day when we have most of the staff in, but 2 people were out sick, and et cetera, et cetera. So obviously, there are certain things you can't control for. Some people are going to be sick, et cetera. But as we mentioned earlier in the steps, what you want to do, and we'll talk about this in terms of selecting your model and method, is if you can choose a method that allows you to present both to a group, but also allow people, let's say, who are home with a bad cold, or who are off for that day, or happen to be at a conference, or something like that. It's only 1 hour. So it would allow them to potentially log in and participate at this sort of challenging time. You don't want half a dozen or 50% of your group to be, to have some excuse, and I put that in air quotes, not to attend the event, because then you've got that same little problem where you've got a portion of your staff that is procrastinating, and then you've got to chase after them and figure out when they're going to take it and get all that done. Whereas if you select a model that allows multiple people to attend, both regionally and remotely, then you've got some flexibility there, and the likelihood of a high percentage of participation, boy, that was a lot of P's, a higher percentage of participation is more likely.
Obviously, you need to promote the event. Again, this kind of seems like a no-brainer, but you need to keep people's awareness up around the event because, again, people are very busy. They have a lot of things to get through in the day, and this is probably not something that they're going to keep at the foremost of their mind. So, we all know the methods of doing this. You have an internal newsletter where you mention it. You have reminders via email, flyers around staff areas. And to speak to that, there's also a requirement in the security rule for a HIPAA awareness program. And training is part of that, but it's not all of it. So you really need to have HIPAA awareness be part of the culture of your organization. And that's the way that HHS describes it. They say that the purpose, for instance, of conducting audits is to promote, quote, a culture of compliance. And that's really the whole point of this. That's what they're trying to build. They want everyone to be aware of HIPAA and to think in a way, to go about their business in a way that keeps HIPAA in mind and that protects the information of patients. So you want to make sure that everyone's aware of the upcoming training event so that they don't have conflicts. You want to make sure that people, set it aside in their calendar and take it seriously so that you can complete that training requirement. All right. How can people go about sweetening the deal for this sort of event, Wendy?
Well, and this is the part that I'm often challenged to help people with, because, we have birthday parties for people on our staff. We have, various fun events that we will do, Christmas parties, holiday parties, those kinds of things. But, you often don't sort of wrap your mind around having a little gathering or incenting your audience to attend a training of this kind. So, this can be a very simple process whereby you think about the kinds of things that your group likes to do. Sometimes it can be during the event, sometimes it can be after the event. The idea is to make it feel like, something positive that they are doing in order to either get to a goal or get to a reward of some sort, or combine it with, if you're going to be doing it in a conference room, order some pizza. Combine it with some other positive incentive so that they feel like, it's not just, a driver training class that they're forced to attend, that they're actually participating in something that they might enjoy.
Absolutely. So that can really help. And before we go on, I just want to mention to the audience that if you have questions, feel free to ask them now. It doesn't have to be about training in particular. Any question you have about HIPAA, we'd be happy to answer. I know that Wendy is actually going to have to get off the call here in a little while, but I will be here throughout, and I've got a lot of experience in HIPAA, and I'm glad to share that expertise with anyone out in the audience. So you can hold your questions till the end if you like, but do feel free to ask them now if you prefer. Okay, so this is an important aspect of it, allowing on-site or online participation. So really, people have different preferences when it comes to learning. There are some people, like myself, I'll volunteer that, who very much prefer to learn on their own. I really don't like to sit in a group and learn if I can avoid it. I would much rather sit in front of a computer and learn at my own pace. That's just the way I prefer to learn. There's other people who feel very differently. There's some people who really want to be part of a group. They enjoy sort of the group dynamic. They like listening to other people's questions. That's an important aspect of it for them, that social aspect of learning. And there's no reason why you can't accommodate both. That's the good thing about online training, is that online training, you should be able to have both options available to people. So you can get a group together where they can learn together the same material and then also, benefit from each other's participation. But you should also have options available for individuals so that, for one thing, if they can't make that one-day event, if they really have a legitimate excuse for not being there, and then they can do it on their own. And that's really the third bullet point there, is the on-demand access. So if you've got that option for online training, that you really have the best of all worlds, is what I'm trying to say here. You've got the option of having people learn in a group. So for people who like that social aspect, they've got that. You've got the option for people to learn individually. It could even be at the same time if they prefer to do it. Or if, as Wendy said before, if they're at another site, maybe they can't make it into the lobby, or the conference room or whatever, to actually complete with the group, so they could do it on their own. But then you've also got that option for people who can't make that one-day event to do it later. And then there's also the option, the nice aspect of, if you've got someone who signs up and joins your organization after the event's completed, you don't want to wait a full year for that person to get their HIPAA training. That is a terrible risk, and if OCR were to find that, they would say that your employee onboarding is not adequate. So you want to make sure that someone who joins your organization later is able to participate in the same kind of training that everyone else is. Wendy, I don't know if you are still with us. Would you like to add anything to that?
Yeah, no, just that, like I said, flexibility is the key, I think, in making sure that everybody gets trained. Obviously, my as a manager, my preference is to get everybody in the room at the same time, get them excited, get them engaged, get their training done. You know, 1, 2, 3 is sort of my favorite way to approach a problem. That said, you know, depending upon the size of your staff or the size of your group, you may find that there's a certain percent that cannot be there live in that immediate moment. And if that's true, then it's good to have options so that other folks can join in either on their timetable or in some remote manner, again, with the goal of the HIPAA one-day challenge here to make sure that you can kind of knock out as many of those required trainings as possible.
All right, so creating competition is another aspect that can help. Wendy, why don't you start off on this one?
Okay, sure. You know, again, what you're looking for is a way to incent people to participate. What we've learned in working with a variety of different clinical and business associate sites is that when you create, you know, some level of low-key, competitive end goal to the day, you're going to get a higher rate of participation and sort of a higher focus on actually achieving whatever goal you're outlining. So a couple ways that you can do that. You can say you can shoot for a high score on the final test if there's a final test involved. You can do a high speed and high score competition. You can provide a reward of some sort for success, you know, and throw in an extra flex day or you know, report on the progress of your staff as they attend. So you can start to say, you know, this person is 50% done with the training, this person is 80% done with the training, you know, some kind of level of competition. And then at the end, make a big deal out of, you know, announcing who your winners are, provide some kind of a prize, you know, some sort of congratulation in addition to their certificate or certification, whatever you're issuing for that event.
Absolutely. You know, just even little things like that can really make a big difference. So celebrating success is also important. You know, if you set a goal and your group meets that goal, then you should absolutely celebrate that. So schedule a party or offer some kind of future benefit for everyone who participated. You want to keep a copy of all the documentation around this training for HR files, for example, and for your own compliance packages, you know, the place where you're tracking all of this, and you should have an option where that's available digitally as well. That's something we haven't mentioned, but that's important. So you want to have all of this material kept in your HIPAA file, but you should also, in case anything were to happen, if you were to lose that material somehow, you should also be able to log into an online portal and get that at any time. You should be able to contact that training group and get verification if there was ever any question from the government about meeting that training requirement. But you also want to hand out the certificates to the individuals who completed the training. You know, it's not a huge deal or anything. It's not like graduating from college, but still having that certificate that proves that they're HIPAA compliant is something that they should be able to put their hands on and, you know, acknowledge that they've learned what they need to learn. All right, well, let's go ahead and look at some of our questions today. Let's see here. Our first question is about business associates, and I like this one. So again, any of you out there in the audience, if you have questions about this or any of our other subjects, please feel free to go ahead and weigh in. We'd be happy to answer your questions. But our first question from the audience is, if we have a business associate relationship with someone, as a doctor office, would we want to request verification that the BA is completing training? Now, there's two ways to address this. First of all, Your business associate agreement. Remember that you've got to have business associate agreements in place with everyone who is a business associate of yours. I'm going to go ahead and move this on to the next slide because that other one's kind of boring. You need to have business associate agreements with all those people, and part of what that agreement actually says is that they're going to be fully compliant with HIPAA. And so that includes training. So first of all, those folks who are business associates are contractually obligated to be training compliant as well. So that's a contract that you have with them where they're essentially vouching that they're going to complete training. And so it should be no problem for those folks to provide verification. So, you know, it shouldn't be an issue. It should be easy for anyone who's completed HIPAA training to go ahead and provide that verification. So it shouldn't be a problem. First of all, the first thing I would do if I was curious about this is I would talk to the business associate and I would say, I'd like to talk to your compliance officer. And if they say that they don't have one, or if they can't figure out who it is, they're not compliant with HIPAA, and that's something you need to look at because you should have an agreement, a contract in place with them, and if they're following the terms of that contract, that means that they do have a compliance officer. So right away then you know you've got an issue. But if they say, oh yes, so-and-so is our compliance officer, well, it should be no problem, it should be no issue for that compliance officer to provide verification of the training. All right, let's go to another question here. Okay, this is a question we get. It's another business associate question about whether someone counts as a BA if they're just providing cloud services. This has been something that's caused a lot of confusion out there. The answer is yes, if they're housing protected health information. So it used to be in the past that if someone actually had to get their eyes on the PHI for them to count as a business associate. And remember that according to the regulations, the definition of a business associate is someone who has access to a covered entity's PHI in the course of providing services to that covered entity. And so it used to be that someone actually had to look at your PHI to count as a business associate, but that changed with the Omnibus Final Rule. The Omnibus Final Rule came into effect last year, and one of the things it said that changed things is that merely maintaining PHI makes someone a business associate, and that was specifically directed at this question of cloud services, which are becoming a very important part of how people operate digitally these days. I mean, I think individually we probably all are in the cloud, and many businesses are moving to the cloud because there's so many advantages to it. There's advantages from a cost perspective, but there's also advantages from a HIPAA perspective too. So for example, another requirement of the security rule is that you have disaster recovery capability. Well, that's a lot easier to do if you're in the cloud, frankly. You can do it by, in the old server approach, but it's more work. It's really easier to do if you're in the cloud. But you have to be business associates with whoever is running those cloud services if they involve PHI. And you'll hear people say, sometimes you'll hear cloud services say, well, we never, access the protected health information. It's locked away. We can't even look at it. Unfortunately, under the new rules, that doesn't matter. Because they're maintaining that PHI, those folks are business associates. And I'll tell you, there's a lot of great companies out there who are providing cloud services to healthcare providers. They get it. They understand what the requirements are. And so you shouldn't have to argue with anyone over this. If you're talking to a company and they say, well, we're just not willing to sign a business associate agreement, then you should not use them because there's plenty of cloud service companies out there who understand what the requirements are. They'll be happy to discuss them. They'll be happy to sign business associate agreements. And then you can rest assured that you're fully compliant with the law. So before we get to our next question, I want to just address our own take on this. Obviously, we've been sharing with you our philosophy on how this should be done. So we've actually gone about building this for you as well. So, there's lots of great companies out there providing HIPAA training. Obviously, we think we do it well. So if you're out there and you're saying, wow, we really need to get on top of this, and I know we talk to providers about this stuff all the time. So I know that a lot of people have put off their HIPAA compliance till the fourth quarter this year because they had so much going on. It's been kind of a crazy year for people with meaningful use, and then that was delayed, and ICD-10, and that was delayed, that a lot of people have been kind of slow to catch up this year. Well, if you're in that boat, it might be attractive for you to join our HIPAA training workshop. So we provide training online, self-paced training, and we've done that for quite a while now. It's really best-in-class training. It covers all of the rules and regulations that people need to understand, but it's also very practical and focused on, making sure that people actually do what they need to do to avoid breaches. That's what this is really all about. Well, we've decided to try something new in line with the discussion we just had, which is we do instructor-led training now, where you have a webinar like this, except it's completely focused on HIPAA regulations and what people need to know, and you have an instructor, but it's a hybrid. So it combines all the benefits of both approaches. So the idea here is you get your staff together, you get them in a room, everybody listens to the instructor lead the discussion, they understand what they need to know about HIPAA, and then afterward they log in to a student dashboard where they take a very brief exam, they pass that exam, they get more than one try at it if people have a little bit of trouble, and they get that certificate. Now there's a couple of advantages of doing it this way. One is that the recording of that webinar then goes into that student dashboard, and so if anybody missed the event, or if they take the exam at the end and they realize they weren't paying as much attention as they thought they were, they can go back and review that recording. And then, so you've got that on-demand access that we talked about earlier. But there's other advantages as well. One of them is that whoever's in charge of this effort, if it's the compliance officer or another manager, they can get those certificates in perpetuity, as we were saying is important. So you should download all of those and print those out for everybody and print them out for your own files. But, things get lost, stuff happens. And so if you need to verify that training, you can always go into that student dashboard and print those certificates off, even if it's a long time after the event. The other thing is we talked about the importance of oversight. And so this training is mounted in a sophisticated learning management system, and that's really the way things should be done these days. The days where you logged in and you watched a PowerPoint presentation and then that was it, very ephemeral, that's not really the way it should be done now. The advantage of using an LMS, among other things, is that you can have that compliance officer or manager log in and actually oversee the training. And so you can have that person go in and look at each individual. They can see, if they're 60% done, they can send a message right inside the student dashboard and say, hello, Susie, I noticed that you've only gotten through half of the training. You really need to finish this ASAP so that we can be compliant. Please take care of it before the end of the week or something like that. But you can also run reports out of the system too, which is nice. So you can just hit reporting, hit people, and you get a nice report in either spreadsheet or PDF form that lets you, at a glance, confirm that everyone has completed the training or see who's fallen behind a little bit and needs to catch up. All right, so that is just my pitch for that. We're happy also, I should mention before I finish with that we're extending a 20% discount to anyone who participates in this webinar and would like to try out that online training. You use the discount code HIPAA one day to take 20% off. It's very affordable. And we have a discount for groups as well. So when you get the slides of this, you can click on that HIPAA training webinar, but if you'd like to look at it now, just go to www.formedworkshops and you can learn more about that event, and we'd be pleased to have you join us for that event. All right, it looks like we've got one more question. I'll go ahead and address that. And the question has to do with losing hardware. The question is, I've heard that if you lose a laptop, but you can prove that no one ever accessed the data, that's not a breach. Well, okay, I'd be very cautious here. And this is another way in which the HITECH Act actually changed the HIPAA requirements. So it used to be, before high tech, that if you lost hardware, for that to count as a breach, there was this standard called harm. Basically, the presumption was that unless that data got accessed by someone and used by someone, that wouldn't count as a breach. But high tech changed that. And so what high tech says is that the presumption is that it's a breach. So if you lose a laptop, and another important point is, if you lose a laptop where the data is not encrypted, I'll address that more here in a second, that's a breach. Because the presumption is that that information is now available, could be thrown into the public domain, and all of those people are vulnerable to identity theft. Now, in most cases, that's probably not true, is the thing. Because if you look at a lot of the large breaches that have happened, a lot of the time, it's just, to be honest, common criminals stealing laptops. They don't know that there's PHI on the laptop or the desktop. You know, we had a large breach here in Chicago where a very large health system had a huge breach of records where someone broke in and stole some desktops. And there was a big breach in LA this last year where a business associate of LA County had a huge breach where someone broke in and they stole a bunch of computers. There's no reason to think that those folks were interested in the PHI, and yet those are breaches because merely losing hardware that contains PHI is a breach. Now, there's an important exception to this. The exception is that if the information on that hardware is encrypted, it does not count as a breach. So that is critical to keep in mind. And in fact, I was reading the other day an update from OCR. You know, there's more, anyone who breaches more than 500 records goes on what most people call it the wall of shame. The government doesn't call it that, but it's a website maintained by HHS where all of those get posted. So we're up around 1,200 organizations up on that wall of shame just in the last 3 years. So that's really something to think about. The estimate is that about 30 million Americans, at least 30 million Americans, have had their healthcare records exposed. But the number that really struck me the other day is there's a lot of breaches that are below 500 records at a time, and in fact, most of them are. And OCR is the first time I've ever seen them talk about this. They gave a number for how many of them there have been. 122,000 breaches of 500 records or less. And the other part of it that was interesting is that they mentioned how many of those could have been prevented through encryption. And the number was 60%. So that is really something to think about. If you do not encrypt PHI, you really want to talk to your IT staff or your MSP, whoever handles those technical issues for you. It's not that hard to do now. Some operating systems include encryption as native software. So if you're looking at like Windows 8.1, that's something that's probably built right in. And it's even on 8.1, my understanding is that it's defaulted on. So there's great, and even if you don't have an operating system that provides encryption, it's not expensive to do it these days. And so that's something that you want to handle for all PHI. Whether you're talking about PHI that's sent electronically somewhere, you should never send PHI through an unencrypted email. Anytime you're transmitting PHI, it must be encrypted. But also, it needs to be encrypted at rest. Technically, at rest means, if it's on a hard drive. Technically, it's not a requirement of HIPAA, but it is absolutely something that you should do because, again, 60% of those breaches where people faced all kinds of headaches. They faced fines from the government. They faced often lawsuits from the people whose data was exposed. They faced the costs of consumer protection, and they faced embarrassment and damage to their reputation from this. All of that could have been prevented if they merely had used encryption. So a lot of people could have been saved a lot of heartache if they'd used encryption, and that's something that your HIPAA training should discuss as well. So certainly no one should ever load unencrypted PHI on, say, a flash drive. There's lots of people who want to take their work home with them, and that's perfectly fine as long as it's done the right way. But there's so many stories on the wall of shame about doctors loading PHI onto a flash drive, then they go jogging and they lose the thing. And merely losing that flash drive is a breach, and it can really cause just enormous trouble for your organization. So if you ever do put anything on a flash drive, make sure it's encrypted. Certainly anything like a laptop should be encrypted, but really desktops in your office should be encrypted as well, because you never know when someone's going to break in, and that's always an unfortunate situation. But if you're talking about bringing the government in because they stole a desktop that has 1,000 records on it, that only makes that unfortunate situation much worse. So that's not something that you want to have to deal with, and if you get everything encrypted, you don't have to worry about it. Someone just popped up a question, how can you check if a flash drive is encrypted? Well, it would depend on the software you're using. If you're asking that, my guess is that it's probably not encrypted. So, again, it's something where you want to talk to your technical folks. If you've got an MSP who provides services to you, they should be able to answer those questions easily. And if the flash drive isn't encrypted, they should be able to provide software to you where they can make it encrypted. And so, sorry, I'm just reading other questions that are popping up. So that's something that would depend on the technology you're using. And so there's no pat answer to that. But before I go on, I just want to circle back to finish that last question, because I got off on a sidetrack with encryption, which is, I don't mind because it's so important. But someone said, if you can prove that the data was never accessed, does that mean it's not a breach? Well, the important word there is prove. If you can forensically determine, if you can access that device and actually prove that it was never accessed after it was lost, and if you can remotely wipe it or recover it, then that would then meet the standard for not being a breach. But that is going to be very unusual. Most people don't have the capability of doing that. And so that's something that you really need to save yourself the trouble of by simply encrypting. Then you don't have to worry about it. All right. So it depends, again, on what encryption technology you're using in terms of checking whether a flash drive is encrypted. But if you have any doubts, you want to make sure that that thing is encrypted before you actually take and put any PHI on it. So someone asked, how did the HITECH Act make HIPAA more stringent? All sorts of ways. All sorts of ways. HITECH really changed the game when it comes to HIPAA, and that's why it's really a new world. HIPAA, when it was passed in '96, that was a very low-tech world compared to where we are now. And so although it did have requirements around, the encryption requirements were in the original legislation, HITECH changed all of that and made HIPAA much more stringent. The HITECH Act was passed in 2009. It was part of the American Recovery Act, often called the stimulus. And so one of the things it did is it greatly increased fines for HIPAA violations. It used to be that fines, I think they used to cap out at, I can't remember exactly, but it was maybe $200,000. Now, each violation can have a maximum fine of $1.5 million. And that's part of why we've started to see these really big breach penalties come down from the government. I think the largest one ever just came down, and I want to say it was close to $5 million this year. Now, that was against large healthcare organizations that really had not done many of the things that they were supposed to do, and so the government was making an example of them. There's many smaller penalties that are being levied against folks. So one of the things HITECH did is it really increased the penalty structure. The other big change it made was that it brought business associates under federal control in terms of HIPAA compliance. So business associates have been part of HIPAA from the beginning. They used to report to the covered entity. So it used to be that if a business associate breached a bunch of records, then the covered entity was the one who was on the line. It was the federal government would come to that covered entity, and it was really on them. The business associate might have violated a contract with the covered entity by doing that, but they weren't responsible to the federal government for breaching those records. Well, all of that has changed. HITECH changed all of that by making business associates directly responsible for HIPAA compliance to the same extent as covered entities. And so for the first time after high tech, business associates had to get a risk analysis, just like covered entities have to do. That's the first requirement of the security rule. Business associates had to have proper policies and procedures around handling PHI, and business associates have to then complete training, as we were saying. So all of the things that covered entities have to do, with the exception of things like handing out a notice of privacy practice, because obviously BAs don't directly interact with patients, those are all things that business associates have to do. So high tech really changed things, and I think people are just starting to realize how much. You know, the omnibus final rule just came into effect last September 2013. And so folks are really catching up. You know, and the last part of it just came into effect this last September 2014, which is that they gave kind of a window of leniency where if you had previous business associate agreements with someone, you didn't have to immediately replace those because the HITECH Act changed the requirements for what has to go into a business associate agreement. And they gave you an extra year to do that, but that year is now expired. And so if you've got, you know, a 3-year-old business associate agreement on file, you got to replace that thing. So all of that has changed. So I'm going to address one more question in the time that's left, and then I'll just have a concluding note for you. And the question is, what about Gmail? Is that encrypted? I want to speak carefully here because, first of all, Gmail is changing quickly. And so I'm a little reluctant to speak about Google specifications. I know that Google transmits data, or that it encrypts data in transmission. So if you're sending a Gmail email, when that's going to their servers, that information is encrypted. In the past, the information on their servers was not encrypted, and so that information was vulnerable to being hacked. My understanding is that now Gmail does encrypt all of the information on their servers, and so that provides an extra layer of security. But there's a couple things to keep in mind here. One is that if you're using Gmail's personal email service, they're not a business associate in the sense that they won't sign an agreement with you, and so then you're not in compliance if you're using Gmail to send PHI. My understanding is that Gmail Business, you can use their tools now as a business, that they will sign a business associate agreement. I can't confirm that. That's just what I've read in passing. If that's true, and if you sign up as a business class user of Gmail, that might be an affordable option for you to have encrypted email to transmit that PHI. The other thing to keep in mind, though, is that if you're sending it to patients or people who are using other email services, that Gmail traffic is not going to be encrypted on their end. And so, again, it's not going to be protected, and it wouldn't be a good way of going about sending that information. There are better tools for having really good security on email than Gmail. Although Gmail has come a long way, I have to say, in the last couple of years, and I certainly have nothing but respect for the folks at Google. If you're interested in using Gmail, I would look into that business class Gmail cloud software and see what they say about signing business associate agreements. Remember that any email you use that transmits PHI, that party, if it's a third party, they're a business associate, and they have to sign that agreement, or any email you send is automatically a breach. So do keep that in mind. Well, thank you so much for joining us today. We've run out of time. It's always fun for me to answer questions because it kind of gives me a window into what people are thinking out there. Remember that all registered attendees of this session will receive an email with links to both the slides and the video recording of this session. Remember to join us for our next Learning Lunch. You can visit our homepage and click on the Learning Lunch icon, which is that lunchbox you see on your screen. Or you can visit formedlearning.com to learn more about our upcoming Learning Lunches and register for those events. Our next Learning Lunch is actually tomorrow, October 21st, and has the title, How Do Docs Really Feel About HIT in 2015? So that promises to be an engaging discussion. Keep an eye on your email box on our homepage for other upcoming topics. And thank you again for joining us today.